going to start the discussion about the general anatomy of the reproductive tract of a cow. How you can say this is the tract of the cow?
Due to the yellowish fat.
There is some kind of change in the color of the fat in a cow from the buffalo. So this is the tract of the cow. Okay. If you look at this part of the reproductive tract, this is having this skin, right? So it means that this is the part of the perineum. Why I'm talking about the perineum? Because having the anal sphincter and the opening for the reproductive system, that is the vagina. I'm sorry, this is the vulva. The opening for the reproductive tract outside the environment, that is the vulva. Okay. So if we talk about the anatomy of the vulva, it is actually having this is the dorsal commissure of the vulva, and this is the ventral commissure of the vulva. Okay. So this has some kind of the application in our next procedure. That's why I'm discussing about the commissures or the identification of the ventral and dorsal commissure of the vulva. So these are the vulvar lips. Okay, so this is the point where the skin and the mucosa are get joined. That is known as mucocutaneous junction. This is the mucocutaneous junction. Just the point where the skin is just in close contact with the mucosa. This is the mucocutaneous junction. Okay, so normally it should not be exposed. If it is somewhat, you can say, exposed outside the environment, it means some kind of the inflammation is there. Okay, normally it should not be exposed. The vulva should look like that. Okay, so this is the dorsal commissure and this one is the ventral commissure. This is the dorsal commissure, this one is the ventral commissure of the vulva. If we look at the mucosa, this mucosa is actually the part of the caudal vagina, or you can say the most caudal part of the vagina is called as vestibule. Okay, if anatomically we define vestibule, it means that the part of the vagina that is the caudal most, and it is having you can say the clitoris on its floor. What is clitoris? The remnant of the penis, or we sometimes say that the rudimentary penis in the female reproductive tract is known as clitoris. So you can look for the clitoris over here, and you have the idea about the size of the clitoris in mare. In case of mare, normally the clitoris is well developed, but in case of bovine, it is smaller as compared to the male. So this is the clitoris. Okay, and if you further move toward the pelvic, you can say urethra. So this is the just opening of the pelvic urethra. Okay, so this is the opening for the urinary bladder. The urine will come out from this passage, and this will be known as pelvic urethra. The urethra, the opening of the urinary bladder cavity is called as pelvic urethra. So the part of the vagina having pelvic urethra, and there is a blind pouch just below the pelvic urethra. You can say that this is the urethral diverticulum, and then you have the clitoris. It means that the part of the vagina that is having the pelvic urethra and urethulum and clitoris will be known as vestibule, the most caudal part of the vagina. And that you can look at the clinics and you can visualize the change in the color of the mucosa and any kind of the lesion if you are looking for. So, but if you are going to study, you are going to observe the anterior or cranial vagina, then you can need this kind of the instrument that is known as vaginal speculum. This is for the small ruminant and this is for the large animals. Okay, so you can check it in your coming classes. I'm not going to expose it right now. So any one of you if having any question about the vestibule. Vestibule is the caudal-most part of the vagina that is having the clitoris and pelvic urethra and urethral diverticulum. Okay, urethral diverticulum is important when you are going to pass the uterine catheter into the reproductive tract or the AI gun. You have to avoid that blind pouch. Why? Because if you are going to stuck your AI gun or the uterine catheter inside the urethral diverticulum, it means that it can get entered inside the pelvic urethra. So we have to avoid it. So there is a standard procedure how we can avoid the entry of the uterine catheter inside the pelvic urethra. Okay, so that's why this was important. Okay, so this is the vulva, and this part of the, you can say, perineum or the skin you are looking for, this is making the anal sphincter. Okay, this is the passage for defecation. Okay, so this is the anal sphincter and this is the vulva. So this is the opening for the